اه يا سلام. يا فندم ماي بليجر.
بسم الله الرحمن الرحيم. احنا يسعدنا ان احنا هنبتدي الجلسه الاولى اللي هي الاي في اف براكتس ان ايجيبت، واحنا نستضيف كوكبه من الدكاتره والعلماء. احنا بس بندي تنويه في الاول ان صلاه الجمعه هتبقى الساعه 12 مش الساعه 1، فركزوا بس في النقطه ديت، لان الساعه 12 كان المفروض في البرنامج حسب التوقيت الصيفي ان هو يبقى مستمر معانا البروجرام. لا، احنا الصلاه الساعه 12، وبعد الساعه 1 هنرجع تاني للمكان، هنعمل تيلي كونفرنس، وبعد كده نبتدي البلينري سيجن باذن الله. اوكي، اتفضل يا بيه. دكتور يحيى وفا يبتدي الجلسه بعد اذنكم.
بسم الله الرحمن الرحيم، والصلاة والسلام على خاتم المرسلين ومن اتبعه بإحسان إلى يوم الدين. طبعا يشرفني ان ابقى موجود في مؤتمر مستشفى جنة النهارده. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. The co-chairman, Professor Ahmed Yusuf. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. The co-chairman, Professor Ahmed Yusuf. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. The co-chairman, Professor Ahmed Yusuf. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. The co-chairman, Professor Ahmed Yusuf. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. The co-chairman, Professor Ahmed Yusuf. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session. On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
المستقبل كله بإذن الله.
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
Really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
Really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
really, it's being so
On behalf of the co-chairman, it is my honor to be on the hot table today presenting the first session.
really, it's being so figure for a pregnancy rate in an IVF center. So the problem is, how could we increase our pregnancy rate? So the question here that we're going to be answering by the end of this presentation is, which of the following factor or factors will lead to the best pregnancy rate in an IVF center? Is it the IVF doctor? Is it the embryologist? C, patient selection, or the paramedical, or it's all of the above? I bet by now, for sure you know the answer, but let us hold to the answer till we finish the presentation. We do our best to try to increase our pregnancy rate and the success rate by using different agonists, by using different protocols, antagonists, and so forth. But the majority of our patients, in the reality, they were going to reach to the stage where they reach to the stage of embryo transfer. But who will really get pregnant as a clinical pregnancy in such cases? There are two major factors will increase your pregnancy rate. Number one is the evidence-based medicine, and number two is the techniques that you are using to increase your pregnancy rate. So we always say it takes two to tango. As a matter of fact, in the field of reproductive endocrinology and infertility and assisted reproductive technology, we shouldn't be saying it takes two to tango, it's 3 or 4 to tango. And if these 3 or 4 factors, they do not tango together, that means there is something wrong. So let us look. I'm not going to go into the details because of the time limitation. So let us look into the different factors. Especially if you are opening a new IVF center, right? Let us look into the patients themselves. Patients, number one, we get to have a good look into the cause of infertility. I mean, as starting an IVF center, we shouldn't be selecting patients who have who are poor responders or have Turner syndrome, for instance, that is a mosaic Turner syndrome, or patients who are above 40 years of age, because patient selection here, it becomes very important. Or you get to select patients who have like previous failed trials, 5, 6, 7, 8 trials, failed trials, unless if you are going to do something different for those patients. So patient selection, it comes to the first factor in opening a new IVF center, and then it comes to the ART physicians. It's good and well to have junior RE physicians in your unit or in your hospital, but it's very important to have senior IVF physicians in your hospital. At least 1 or 2 IVF physicians should be present in the unit at all the time, because if there is a troubleshooting with the junior guys, then they can always come back to you. And most of the centers, they will have fixed stimulation protocols, fixed drugs that they are using. I wouldn't advise an IVF center to have a fixed protocol, because what happens usually, you get to tailor the medications according to your patient's need. So these are the most important thing, and then it comes to the OPU and embryo transfer. Of course, some more expert people, maybe they're going to talk about this in details. And we look into the embryologist and the ART lab. I do consider my embryologists, they are my backbone, because without them I cannot do. So you need lots of experience from your embryologist. You need the most important of all is the quality control, right? So you can get somebody on annual basis or biannual basis to come and inspect your center and inspect your lab and so forth, and so on and so forth. And we do not get to forget the paramedical guys who come and clean the lab for us and do all the other stuff. So all of these 4 points should be kept in mind. Why I'm saying the embryologists are our backbone, because honestly, without them, we cannot do, because it's for a very simple reason. They have the custody of the gametes and the embryos. Once in the moment of the egg is being aspirated and the sperms are being